Everyone. Today we will be covering the most common maternal infections that affect pregnancy. Torch infections is an acronym for a group of diseases that cross the placenta and may cause teratogenic effects. Teratogenic effects are fetal abnormalities and congenital conditions affecting the newborn if the fetus is exposed while in utero. TORCH stands for toxoplasmosis, other infections, which may include hepatitis, syphilis, HIV, rubella, cytomegalovirus, and herpes. We are going to discuss these individually. HIV. HIV is a virus that can be transmitted to the fetus through the placenta in utero, during labor, or after birth to the newborn through breast milk. In Illinois, state law mandates we screen for HIV twice during each pregnancy. Initial HIV screening will be done at the prenatal visit and again during the third trimester of pregnancy. If a client is HIV positive and has a low viral load, she can deliver vaginally at 36 weeks gestation. If the HIV positive client has a high viral load, a scheduled cesarean section will be done at 38 weeks. For nursing care, it is very important that the newborn is bathed immediately after birth, and we must educate the client to not breastfeed. HIV positive clients will receive antiviral therapy both during pregnancy and labor. Newborns born to HIV positive mothers will receive Retrovir, which is an antiretroviral medication used to treat maternal fetal transmission. Hepatitis B. Hepatitis B is a viral liver infection. All pregnant women are routinely tested for Hep B at their initial prenatal visit. Providers are now also testing for hepatitis C, especially in women with a history of opioid or IV drug use. There is a safe and effective vaccine that prevents the hepatitis B infection. If a client is not vaccinated and is hepatitis B positive, then the virus can be transmitted to the fetus. If the mother has an acute infection, which means she has been infected less than 6 months, then the newborn has a 9 in 10 chance of getting infected. In chronic clients, so clients who have had an infection that has lasted more than 6 months, the chance is reduced to 1 in 10. After birth, newborns born to infected mothers need to receive both the first dose of the hepatitis B vaccine and the hepatitis B immune globulin within 12 hours of birth. Nurses need to stress the importance of the newborn receiving the second and third doses of the Hep B vaccine at the pediatrician's office. Nurses also need to educate that breastfeeding is safe and encouraged. Rubella is a viral infection that can cause miscarriage, congenital abnormalities, or death of the newborn. CRS, congenital rubella syndrome, can cause deafness, cataracts, and learning disabilities. The rubella titer is screened for during the initial prenatal visit. If a pregnant client is non-immune to rubella, it is recommended to receive a rubella booster vaccine postpartum prior to discharge. The nurse needs to educate the non-immune client to stay away from anyone infected or not vaccinated. The vaccine that is normally given is the MMR, the measles, mumps, rubella vaccine, and this is a live vaccine that cannot be given during pregnancy due to the teratogenic effects on the fetus. It is extremely important when giving the rubella booster to educate clients to avoid getting pregnant for 4 weeks after receiving the vaccine. The herpes simplex virus, HSV, has 2 types, HSV1 and HSV2. HSV1 is mainly transmitted by oral-to-oral contact. HSV2 is a sexually transmitted infection causing genital herpes. HSV2 is screened at the initial prenatal visit. HSV can cause miscarriage, preterm labor, and intrauterine growth restriction, IUGR. For clients with HSV2, it is very important to take suppression medication starting at 36 weeks gestation to help prevent an active outbreak and transmission to the neonate during delivery. If a client has active genital herpes, it is recommended to have a cesarean section to avoid transmission to the newborn. Group B Streptococcus. A Group B infection, also referred to as GBS, is caused by bacteria naturally occurring in the intestines and urinary tract and typically found in a person's vagina or rectal area. It is contracted from person-to-person contact or from sharing food and drinks with an infected person. It is not harmful to a healthy person. If GBS is transmitted to the newborn, there is potential for severe, life-threatening complications. About 25% of pregnant clients have GBS. Pregnant clients will be screened between 35 and 38 weeks gestation. A client who is GBS positive should receive IV antibiotics during labor to decrease transmission to the newborn. Nurses will also administer IV antibiotics during labor if a client has an unknown GBS status due to lack of prenatal care or delivering before being screened, a maternal fever, or a prolonged rupture of membranes. Syphilis is a sexually transmitted infection caused by a bacteria. A client who is infected with syphilis and is not treated can transmit the infection to the fetus, causing congenital syphilis, resulting in fetal demise, deformed bones, severe anemia, jaundice, blindness, deafness, and/or meningitis. Syphilis is screened at the initial prenatal visit with serology tests. Those are blood tests, and they are called VDRL and RPR. Syphilis is also referred to as venereal disease. Clients who are positive for syphilis need to be treated with antibiotics. Nurses need to educate these clients to make sure any sexual partners are tested and treated. Complete the entire antibiotic prescription and be retested after therapy. Chlamydia. Chlamydia is a bacterial infection that can cause premature rupture of membranes, preterm labor, and postpartum endometritis. If chlamydia is transmitted to the newborn, the infection can cause conjunctivitis and pneumonia. Chlamydia is screened at the initial prenatal visit. If a client is positive, they will receive oral antibiotic treatment and need to be retested 3 weeks after completing the treatment to ensure medication effectiveness. Clients also need to be educated to have any sexual partners tested and treated if necessary. Gonorrhea. Gonorrhea is also a sexually transmitted infection caused by a bacteria. Our nursing care and education is going to be the same as chlamydia. If a client is not screened or does not receive treatment, the infection can cause premature rupture of membrane, preterm labor, and postpartum endometritis. If transmitted to the newborn during delivery, the infection can cause neonatal sepsis and blindness. Trichomoniasis, referred to as trich, is a sexually transmitted infection caused by a parasite. If treated, this STI can lead to pelvic inflammatory disease, chronic abdominal pain, infertility, often due to fallopian tube blockage due to scarring. The most notable symptom is in a woman is a yellow-green or fluorescent green vaginal discharge with a foul odor. If not treated during pregnancy, trich can cause premature rupture of membrane and preterm labor. Treatment includes oral medication. However, this medication is not given during the first trimester due to the teratogenic effects on the fetus. Human papillomavirus. HPV is a sexually transmitted infection that can cause genital warts and cervical cancers. This is considered the most common STI in the United States. There are over 150 different strains of HPV, 40 of which infect the genital tract. There is a vaccine for HPV and it is recommended for both males and females starting around age 11 or 12. It is not recommended to receive the vaccine during pregnancy. HPV is unlikely to cause complications during pregnancy. Maternal infections during pregnancy require prompt identification and treatment. Undetected and untreated infections in a pregnant woman can have harmful effects on the fetus. Transmission occurs through the birth canal at delivery. In order to prevent lifelong injury and disability, it is critical for physicians to identify infections in the mother and treat them accordingly.